Hello, hi everyone. I'm back. So let's get started. Just like to see myself. I've pinned my screen, so you should be able to see me in big. If not, just adjust it on your Zoom screens. Okay. So good afternoon, everyone. If you have a question during the session, please raise your hand. There are 100 people in this group. This session is being recorded. We had about almost 450, 500 people register for this webinar. So because you guys have come in first, you're able to join. The others will be watching the recording. Let's quickly start with a couple of things. I do have a PPT to show you. We will be talking about knee pain, understanding knee pain a little bit, and we'll go from there. Okay. Can everyone hear me well? Okay, so
Yeah.
somebody has said no audio. Please check your device. My video audio both is working fine. Can I go ahead? Somebody give me a thumbs up. Awesome.
Yes.
Umedkar, thank you. Thank you. Superb. So I'm going to carry on. Now, the reason why some of you are here or most of you are here is because you either had knee pain in the past, you have off and on knee pain, you recently um, been diagnosed with something for knee pain. There are many reasons why you may have joined here. Okay. Now, I understand knee pain from a very holistic perspective. We do need to know if something is wrong in the knee itself, but we also need to know, are there other factors that are not allowing your knee to get better? So this is what we will be discussing today. All right. So all of you here, just put in the chat if you have, say, knee pain now, you had knee pain in the past. Just put in the chat. No, I don't want you to unmute and talk. I just want you to put it in the chat, please. I'll look at that. Some of you I already know very well. So I know what your issue is. But others, just let me know what's happening. Okay, so interesting thing. This is a very general session for knee. When it comes to athletes, when it comes to runners or cyclists, the reason for knee pain are very specific and very different. Okay, so all this will apply to you. It will help you. However, if you're a runner, then your knee pain needs to be addressed a little bit differently. I hope you understand that. But of course, a lot of this will anyway help you. Looking at the chat quickly. Okay, so trekking, knee pain on walking, yes. So looks like a lot of you have knee pain right now. So that's great. Any knowledge is useful, correct? Whatever you understand about your body, whatever you understand about your knee will only help you. And I believe that what you know, especially from a anatomic point of view. So I will be taking you through a PPT explaining to you about what the knee, what structures are in the knee, what are the factors that affect the knee. So somewhere some light bulb will go on and say, "Acha, हाँ ये शायद मेरा problem हो सकता है." Maybe that will give you an avenue to work on your knee pain on your own. Okay. But at the end of the session, we will be doing 5 exercises that I think that everyone should do. And don't worry, agar aapko abhi knee pain hai, to these are very safe exercises to be done. So it will not aggravate your pain. I'm not going to give you anything very intense, jisse pain badh jaye, because I don't know your history of knee, correct? So I'm giving you safe exercises to do, but I do have a PPT that I will take you through. Before that, tell me if you have attended any of my sessions before. Some of you are already my patients, so I know you very well. If you have, so tell me if you're a first timer attending my session. First timer. Put it in the chat. I need to see it in the chat also. But thank you for those who are putting it in video. Thank you. So when your videos are on, ना ऐसे लगता है कि मैं किसी से बात कर रही हूँ, है ना? नहीं तो मैं लैपटॉप से बात कर रही हूँ, which is very foolish. So if your videos are on, that will be nice. Thank you so much. Yeah, some of you know you well. Manish. Manish. Yes, so if you are a runner and don't want to be called patient, that's fine. I understand your pain. So if you've never been in my session before, first time, a lot of first timers here. Okay, good. All right. So little bit of background about me. I am a spine and sports physio. I have now 22 years of experience in this field. My company's name is Orthosports Physiotherapy. We are at Shivaji Park. And we focus on taking care of spine issues. We focus on our sports. So our running, cycling tends to be our big focus areas. I personally love treating runners and cyclists. But of course, knee pain is something, back pain is something that is so common that we get so many people suffering from this and then not really getting any solutions, which is why I put together these free webinars for you so that you'll be able to educate yourself and find, at least get guided in the right direction. That's my goal. Um, so that's a little bit about me. So if you have not attended my sessions, I basically do sessions. मेरा Sunday 12 noon fixed है. I do at least 2 a month. I do some paid programs as well. I have a core program going on right now, which is called BBC Bulletproof Core. Any of you are interested in working on your core, can connect with me offline, and I can help you with that. But let's get started on knee. Okay, so let me show you my PPT. Just give me a second, guys.
Yeah, ma'am, just one question. Are
Yeah,
you going to share a recording on group?
this session is being recorded. Yes.
Yeah, but are you providing that recording to all the participants?
Yes.
Yeah, great. Thank you.
Sure. Give me 1 second, guys. Okay, here's my PPT. Can you see my screen, guys? Sorry, I'm just coming off a throat thing. Can you see my screen? Anita, give me a thumbs up if you can see my screen. Okay, awesome. Now, Anita, you'll also
Yes.
have to tell me if my screen moves, okay? How about that? Can you see my slide?
Yeah, yeah,
Yes.
perfectly fine.
Awesome.
Yeah, we are fine.
Excellent. Thank you. I need a new laptop. Hint, hint. Okay, so let's get started. You are here because of any of these reasons. I want you to quickly put in the chat one of these reasons. If you have knee pain now, you've already told me, but if you don't have knee pain, if there are certain things in here that relate to you, please let me know.
Ma'am, if you can put the PPT on presentation mode, that would be great.
Sure.
And let them not chat because that starts reflecting on the screen, which is disturbing your presentation. They can send
No,
you
I
the
need
message
to see
later.
the chat, Anita. I need to see the chat. Thank you so much for your input. Can you see my slide?
Yes.
Okay. Okay, how about now? So this is your reason. You've already told me in chat. What are your reasons? Numbers. Excellent. Thank you for giving me numbers. Superb. So a lot of runners and cyclists are here, I see. Okay, now, what is my goal for this particular session? I'm going to tell you about how the knee works, and a knee is not just a knee. I see so many people जिसको back pain था past में, फिर वो back pain तो ठीक हुआ नहीं हुआ पता नहीं, लेकिन knee pain चालू हो गया. Okay? या vice versa भी होता है कि knee pain था और knee pain ठीक होते होते back pain चालू हो गया. Why? Because our body is one joint is not just a joint, it's interconnected with the rest of your body more than you know. So this is called the kinetic chain. Everything in the body from the brain all the way down to your toes, everything is super connected. So if you have knee pain now, you will need to address, for example, your core, your back, your breathing. Of course, knee को तो clear करना ही है. Muscle weakness है क्या? Flexibility issue है क्या? Okay. There are a lot of things like that that we need to clear. So let's look at what are the practical sessions, what are the things that you can take away from this session, and of course I'll give you 5 exercises and tell me if you think this is true or not. जिसको भी knee pain होता है ना, उसको सबसे पहले advice ये दिया जाता है कि सब बंद कर दो, जो भी अभी कर रहे हो, stairs उतरना बंद कर दो, नीचे बैठना बंद कर दो, चलना बंद कर दो, रनिंग करना बंद कर दो. Okay, this is the advice that is given to everybody. Now, I don't believe in this. I believe that you should be able to do whatever it is that you want to do. However, a short rest break along with active solution is what you need to do. Okay, so it cannot be कि हाँ सब छोड़ दिया, knee pain background में चला गया, थोड़ा थोड़ा कभी कभी आता है, but what is the way of, what is the point of living like that, right? You want to be able to be fit, you have to be able to walk, run, whatever you want to do without knee pain being a part of your life. So that's my goal, and that's what I try to, that's why I do a lot of these preventive sessions to help you understand. So that's a little bit about me. I've already told you. Knee pain after back pain statistically has been shown to be one of those huge musculoskeletal issues. Back pain and knee pain. Okay, back pain सबसे high है world में, global. Everybody suffers from back pain at some point of their life. This is what statistics tells us. After that, knee pain is one of those big ones. And the third one, believe it or not, is headaches. So let's look at, this is the knee structure. Okay, इसको देखो, कहाँ आपका पेन है ना, उसके basis पे sometimes diagnosis हो सकता है. Now this is not for you to self diagnose. You're not a doctor, you cannot self diagnose. However, you can get a clue ना कि कहाँ पेन है, उसके हिसाब से आपको शायद समझ में आए कि what can be the issue और आप क्या कर सकते हो इसके लिए. So if your pain is say on top, आपका पटेला है, patella is basically your kneecap, right? This particular bone here. अगर ये bone, अगर,
Ma'am, the slides are not changing. I don't know.
oh really? Okay.
Yes, we are still on slide 2 on the screen.
Oh, sorry. Then I need to reshare. Thank you for letting me know. Can you see the
Yeah.
photo of the knee?
Yeah.
Yes, yes.
Did it move?
Yes, it has moved.
It has moved. Awesome. ठीक. So based on the area of your pain, so patella, मतलब ये patella is this structure here as compared to उसके ऊपर या नीचे या side पे, okay? All that means different things. कि उस, there are different reasons for pain based on where your pain is. Okay, now look at the knee structure. थोड़ा सा quickly anatomy आपको समझा रही हूँ. ये पटेला है जो आपको बोन फील होता है ना नी के आगे, that's your patella. बोन निकाला है just to show you the internal structures. If you see, the knee joint is a hinge joint like that. एक के ऊपर एक है, ये बड़ा बोन है, ये नीचे भी बड़ा बोन है, and this top bone is one of the longest and thickest bone in the body. ये दोनों को बहुत सारे structures है अंदर which keep them connected, right? Keep them stable. Ligaments are there, meniscus is there, there are ligaments here, under ligaments hai, side pe ligaments hai, plus there is cartilage inside. ये जो hinge joint है यहाँ, अगर समझो किसी इंजरी के वजह से अगर यहाँ पे degeneration है on the capsule cartilage itself, that can create pain. अगर इसमें से कोई एक ligament में issue हो गया है, tear हो गया है, that can cause pain. There are a lot of reasons why knee pain, true knee pain जो internally start होता है, there are a lot of reasons. Okay, now if you are able to clear, understand with an X-ray or an MRI कि internally problem है कि नहीं, then that's a separate issue. Then we have to address that medically. However, majority of knee pain tends to originate from a lot of other factors जो मैं आपको समझाने वाली हूँ. Sometimes अंदर कुछ निकलता है, थोड़ा बहुत निकलता है, but that may not be the reason for your pain. It may not be clinically relevant, or it's possible that अंदर है and that is the reason for your pain. Okay, now that only an ortho or a physio, sports physio can help you figure that out. But there ऐसा भी हो सकता है कि even though this is a cause for your pain, there are so many sorry, there are so many muscular issues going on that is not allowing the knee pain to heal. Okay, and I will tell you about that, what those conditions are, what those factors are. So this part is clear, the anatomy bit is clear, guys. Moving on. All right, now what are those 5 things that I think affect knee? 5 fundas. These are my fundas. One is lifestyle. Lifestyle is a huge critical area for your knee pain. And I will talk about that. I have a slide to show you for that, but it's a major one. That's why मैंने सबसे पहले उसको डाला है. First one is lifestyle. क्या करते हो आप day to day basis में? Is any of that becoming a cause for your knee pain? Is any of that not allowing your knee pain to heal? आप सब कुछ कर रहे हो knee के लिए तो भी knee ठीक नहीं हो रहा है. क्यों नहीं ठीक हो रहा है? Maybe there is something in your lifestyle that's causing that. Okay, alignment is a big one. For the knee, imagine आपका पूरा body weight आपके knee को support करना है ना? Foot is there, but the knee is the junction, is the fulcrum. That those इतने पतले knees को आपका पूरा body weight संभालना है ना? तो alignment is absolutely critical. Whatever is not in alignment is going to topple over time, and our body is so smart कि वो कहीं ना कहीं से alignment लेके आती है. Muscle compensations होगा, एक muscle stronger होते जाएगा, एक muscle weak होते जाएगा. Things like that are continuously happening in our body and we don't even know that. Okay. The third factor is your foot. I cannot tell you how many knee pain issues I have corrected. Pain completely gone only by correcting the foot. Okay, what does that mean? अगर आपका foot position, अगर वो pronation है, supination है, neutral foot है, foot muscles weak है, if there is anything like that in the foot and it's not addressed, knee pain does not go. And foot में also footwear comes ना, आप क्या पहनते हो? आर्च, जो आपके फुट के नीचे का जो आर्च है वो आप सपोर्टेड रखते हो कि नहीं, बेयर फुट चलते हो, घर में कौन से स्लिपर्स पहनते हो, लॉट ऑफ फैक्टर्स इन दैट. ओके, hips and core, point number 4, your hips and your core are the driving force for your knee. अगर आप hip and core को strong नहीं रखते हो, at some point in your life knee pain will be a visitor. Since it's already a visitor in your life, that's why you're here, right? You want to make sure that you get this check कि hip muscles कितने strong है, core कितने strong है, core कितना strong है. Okay, and by core I don't mean only abdominals. Core is a lot of different muscles. I will be showing you a slide for that. Okay, point number 5, mobility versus strength. What does this mean? Mobility is हम कितने flexible है ना? But what is strength? Strength is what are the muscles that support the knee. For example, core हो गया, glutes हो गया, quadriceps हो गया, thigh muscles हो गए, foot muscles हो गए. All these, are they strong enough? to withstand your, to make sure that your knee pain goes away. Okay, so these are the 5 fundas. If you want to take a screenshot, you can. Of course, the recording will come to you. But if you want to, I'll just leave it on there for a little bit. Okay, now, this is lifestyle. Okay, ye dekho. There is weight control. Obviously, agar aapka weight zyada hai, it's all going on the knee. The first advice given to somebody who has knee pain, weight kam karo. Weight kaise kam karoge? Activity to kar nahi sakte, knee pain ho raha hai. It's like this vicious cycle and it never goes away. Okay, but controlling weight if you are overweight is one of those top things. Making sure that your food is okay. बहुत लोगों को लगता है कि हम अच्छे से ही खाते हैं. Nobody wants to think bad about themselves ना. So सबको लगता है नहीं नहीं हमारा तो एकदम perfect है diet. But वो जब हम find out करते हैं तो पता चलता है कि it could be deficient in micronutrients. Okay, I'm not talking about weight loss only. I'm talking about what is the nutrition that your knee needs. क्या आपको मिल रही है वो सब. Okay, so think about that. That's why speaking to a nutritionist is important. Knee brace. Knee brace is knee cap. Short time के लिए अगर 1 week 2 weeks के लिए knee brace पहना तो इससे कुछ नहीं होता है. But I think it gets abused a lot. People start using knee cap और वो चलते ही रहता है चलते ही रहता है. हाँ हमको डॉक्टर ने बोला था पर वो forever वो चालू रहता है. Okay, that actually weakens the knee muscles. If you are one of those, please stop wearing. Exercising regularly. There are 2 groups. One, lifestyle is somebody who does nothing at all, totally sedentary और अभी चालू किया और पेन आ गया. Other group is what जो excessive करता है और उसकी वजह से पेन आ गया, degeneration हुआ, whatever, right? So we don't know. So that's up to you to decide. Insoles, I recommend that everybody should always get at least once get your foot evaluated to see whether you need shoes that are corrective or you need insoles, because that can create knee pain. And I've seen, like I told you, इसमें से कोई भी एक फैक्टर कभी कभी चेंज कर देते हैं तो नी पेन चला जाता है. एंड इट्स सो सिली ना, इतने टाइम से नी पेन है और इतना छोटा रीजन था उसके लिए. सो टेक एक्शन नाउ, डू समथिंग नाउ. Screen has changed, correct, for us? Okay, thank you.
Yes.
Thank you. So now these are the nutritional things that our body needs. Protein intake badhao. Glucosamine chondroitin is one thing that your knee needs for lubrication in the joint. Remember, it's like this. Agar internally damage chalu ho gaya hai, so it will help lubricate the joint so that bone on bone doesn't rub. Okay. Calcium and your micro nutrients and vitamins. These are the things that you should. Of course, you should not self-medicate. I can help you if you want to message me post the session. But I would say that see a nutritionist. We also have a nutritionist in the clinic if you need to connect. But always enlist the help of an expert. Okay, because you will get solutions. You will get the right solution. You will get faster results that way. Alignment. Okay, ye zara dekho. Knock knees, bow legs. First one is bow legs. Second one is knock knees. This one is properly aligned, this third guy. Okay, we all think that we are this third guy, but that may or may not be the cause. वो mirror में देखो. If you want to put it in the chat, 1, 2, 3. 1 is this one, bow legs. 2 is knock knees. 3 is perfect. Tell me in the chat which one you think you are. या पता नहीं है तो ये भी बोलो. I have no idea. This somebody should have checked for you. Sometimes these things you may not be able to see, but and like somebody who's a trained eye, like a sports physio, will be able to tell you. Again, I'm requesting you guys to keep yourself on mute. Use chat. Not sure. Some people are not sure. Some people know which one you are. So a lot of bow legs and knock knees here. Okay. So this, if you are 1 or 2, please remember that this is going to progress with time. Okay, so you need to correct that now. This is another thing, how flat foot affects the leg. Now, these are the exercises that we need to do for the knees. So I'm going to take you through these exercises now. Unfortunately, we have only 10 minutes to continue. Sorry, I think my Zoom is giving me some trouble today, guys. So I am recording this session and I will give you those exercises today.
Correct. I'll just change my specs.
It's okay now. Come, yeah.
I can
Guys,
see.
please keep yourself on mute. I'm telling you again and again.
First floor.
Okay, all right. So this is the exercise routine that we will be doing. Today, the exercises that I want to teach you are these. Okay, these are the 5 exercises. Also, very quickly, just like the BBC program which I make for core, I also have a knee conditioning program which is again 10 sessions, and I teach you everything, taking care of all the aspects that need to be covered in the knee. So, but it is not something that you can just enroll for. It is something that I will have to speak to you if you're eligible for it. So after the session, I will be telling you about these. So the exercises that we want to do today, remember hip is a big factor. So we are going to look at the hip first. So how do you strengthen the hips? The most important muscle to strengthen in the hip is the gluteus medius. Okay. So if you have a loop band, I'm showing you these exercises. I'm going to stop my screen. These are the exercises that we are doing now, guys. Okay, so keep your my screen big so that you'll be able to see me well. If you can do these exercises with me, now we are going to work on the hip musculature. The most important muscle in the hip that we want to work on is the glute max and the gluteus medius. Okay, these are the 2 muscles that support the knee. So this is what you do. If you have knee pain also, this is something that you can do. Okay, so the first exercise you will do, keep your tummy muscles pulled in, loop band around your knees like that. If you need to hold on to something, you can. And all you're doing is this. Okay, remember, see, I'm not doing this. I'm doing this. Okay, this is exercise 1 for the hip. Exercise 2 for the hip is back. Okay, remember to keep this knee soft. And you will do it on both sides. This is working on your hip muscles. This will make them stronger. Okay. So the exercises that I'm showing you today, do it today, for example, see how your knee feels. And then if you feel that it's helping you, if it's not increasing your knee pain, you can add these exercises on a daily basis and it will certainly help you. So, so the first one, somebody asked me if for the loop bands, these are available at sports shops. I have them in the clinic. They are easily available, so you can find them. So the second exercise we are going to do is for the knee itself. Now on the knee, this ye knee hai na apna. This is the patella. Just above that is the quadricep muscle. What I want you to do, either take a ball like this or a balan, and what you will do, you will basically release the muscles on the side here. Dekho kahan kar rahi hu main. I'm not doing it right on top. I'm doing it slightly to the side. The reason is that if this muscle is tight, then that alone can cause a lot of friction inside the knee and give you pain. So ball se kar rahe ho, to yahan aise isko release kar do. Okay, and then take it all the way up, release it all the way through and across. ये मैं पटेला के ऊपर कर रही हूँ, कोन पे बिल्कुल नहीं करना है. Just remember that. Okay, so very simple. First was 2 exercises standing for the hip, outwards and backwards. The second exercise is just releasing that with a balun or with a ball, just releasing some of those structures just above the knee. See how it feels? Sometimes usi se knee pain, it feels like a relief on the knee. Okay, if you have a foam roller, if you're a runner, then quadricep and ITB foam rolling is what you can do to substitute for this one. Okay, clear? Now, we've looked at the hip, we've looked at the knee itself. Now we are going to look at the foot. So for the foot, everybody's foot is different. Okay, walking style is different, fingerprints are different, correct? ऐसा सबका foot structure भी अलग होता है. In fact, अगर आप आपका पैर देखोगे ना, दोनों पैर भी अलग होंगे. Okay, so our foot is so different. So we have to make sure that our foot muscles are basically strong as well. How will you make sure that? I'm showing you one exercise for that. And then I'm actually showing you two. One is for foot, one is for balance. So the first one that you will do, is basically lift your big toe. Can you see? Just lifting my big toe up. That's all I'm doing, one at a time. And when I lift my big toe, I also will tighten my glute at the same time, my hip muscle. Okay, so just lift the big toe, only the big toe, and squeeze the glute at the same time. Okay, those of you who are doing this, what this does, it connects your foot to the core. And this is extremely strong, very effective exercise to do, and a lot of people find it difficult even sometimes to do this exercise. Okay, वो foot या तो उठता ही नहीं है या वो glute contract नहीं होता है. Okay, so try it and see if you're able to get that properly. Right now, the last exercise we are doing is for balance. So all you're going to do is stand on one leg. You're going to tighten this knee. And then you're going to stand on that leg. Okay, keep your abdominal muscles pulled in, keep your glutes pulled in. Okay, if you find that this gives you pain, then don't do it. If you need to hold on, you can. But eventually you should leave the hand, stand. So tighten the knee and stand. Now, how much should you be able to do? How much should a normal person be able to do? 60 seconds, 1 minute. 1 minute का balance इतना strength knee में होना चाहिए कि आप you're able to stand for 1 minute 60 seconds. Try it, see if you're able to do it. Okay, if not, then clearly somewhere strength is missing, na? Right? So all these exercises start doing ASAP. And then obviously the group is there. If you want to ask questions, you can. Those of you who think that working on the knee, making the knee stronger will be useful, connect with me later and we will figure out a program or a plan for you. Those of you who want me to check out your X-ray MRI, let me know as well. I can take a look and see if there is something that needs to be done. We can get on a quick call and we'll figure that. Okay, so some of these exercises are fairly basic, but when you start to do them, you will see how it can help you. Okay. And I think that most people tend to do exercises which are fancy, which are, oh, it looks so great, it's now fancy, but it's not working on the foundation. The exercises that I've shown you today are the foundation to building your knee. So that's all from me today. If you have questions, we have very little time left. So put it in the chat. I'll take 1 or 2 questions. And obviously the group is active. Put your questions in the group. Specific questions kuch hoga to please ask me in the group so that I can take it aram se. They can help you with that. Kneecap should not be worn all the time. No. Okay, so I do think that it weakens the muscles. You want to wear it for a short period of time, only if it is recommended by your doctor. Okay, all right. So I'm checking off, guys. Thank you so much for being here. We will be connected. Do these exercises, share with me if you feel um,